Okay, good morning, everybody. My name's Terry Hudson. I'm a GP in Sheffield and chair of Sheffield Clinical Commissioning Group, and I'd like to welcome everybody to this year's annual public meeting. Due to the pandemic and social distancing rules, unfortunately, we've not been able to hold our annual public meeting in public this year. However, in the interest of transparency and in the interest of connecting with the people of Sheffield who have an interest in the work that we do, we are holding this annual public meeting virtually. Things have turned out differently to what we had expected this year, but as a whole, our CCG has adapted very well to the pressures put on us by the pandemic. So this morning, we will be hearing a little bit about some of the work that the CCG has achieved over the last 12 months through the form of a video. We're going to be hearing about one of the CCG's major priorities, which is to deal with health inequality. We will have a section understanding the finances of the CCG over the last 12 months, and then we will move into a question and answer session covering a number of topics which will be of interest to you. So I'd like to hand over to Leslie Smith, who is our Accountable Officer, to give us an overview and an introduction to this year's video.
Thank you, Terry. And like Terry, I'd like to begin by welcoming you to our annual public meeting. Normally in our annual public meeting, we get the chance to meet you all in person and to spend some time talking to you about the year just gone by, which for us is 2019-20. We normally have a range of presentations and lots of opportunity for personal interaction, conversation and questions. Unfortunately, this is a very different year for us, and we've been thinking about how do we convey the normal messages that we do in our annual public meeting with you. And to do that, therefore, we've compiled an animated video of the year just gone by. It reflects on our achievements over the year, some of our challenges, and very importantly, how we've managed the public funds that have been vested in us, and looks ahead to the challenges of 2021. So what I'd like to do is invite you to join us in our review of 2019-20.
Okay, thank you for taking the time to watch the video, and thank you to our communications team for a really excellent video. My reflection looking through the video is we've all really been tied up in our minds with responding to the pandemic, and the video really highlights and underlines some of the important work we've done in the 6 months prior to the pandemic. So thank you to our communications team for flagging some of those things up. So one of the important elements that really shone through in the video has been our responsibility and our actions to tackle health inequalities. And what I'd like to do is hand over to Brian Hughes, our Deputy Accountable Officer, to give us an overview on what the CCG has been doing and is planning to do to help tackle health inequality in Sheffield.
Thank you, Terry, and good morning, everyone. I'm Brian Hughes. I'm Deputy Accountable Officer at the CCG, and it was really sort of interesting to watch the video, particularly the latter half, which takes us into the most recent period that we've been living through, and that focus on health inequalities. And I want to start with the Health and Social Care Act in 2012 introduced a legal duty on the Secretary of State, NHS England, and clinical commissioning groups to have regard to the need to reduce inequalities in access to care and the outcomes of care. So this isn't something that has come upon us as a result of COVID, but I will talk in a couple of minutes about what we've been doing as a result of that. So we have our commissioning intentions, which we develop every year, are prioritised with a key focus around reducing health inequalities. And we have been focusing on that for a number of years. There is always more we can do, and that's where our effort is concentrating at the minute. In 2019, April, along with the Sheffield City Council, we formally launched our refreshed health and wellbeing strategy. And the strategy recognises that health inequalities affect everyone, and that it is not right that some people can expect to live a less healthy life because of who they are or where they live. And the strategy highlights three main areas that contribute to a healthy life, and it follows the life journey, starting well, living well, and aging well. So the work of the strategy is being led by Sheffield, jointly by the Joint Health and Wellbeing Board, which is a partnership between ourselves as a clinical commissioning group, Sheffield City Council, and a range of partners across the city. It's really clear that health inequalities remain a significant challenge for Sheffield, and we understand that any solution to this will not just be found within health and social care services alone. Therefore, the vision that we've outlined within the strategy is for improving the health and well-being of residents and not just focusing on health and care services. But sort of looking back to the near past in terms of COVID, the effect and impact of COVID has really highlighted inequalities even more starkly than when we launched the strategy in 2019, and that it doesn't affect all population groups equally. I think when we started in COVID, we thought that there was an expectation that it would, but that disproportionate impact has been felt more in those most in need. So what we've been doing in terms of our response, which was highlighted somewhere in the presentation, is really listening and engaging and learning from our population who've lived through wave one of COVID. We've established two forums that have engaged our community groups, and on a fortnightly basis we have phenomenal representation from 30 community groups coming together with us, both to learn and from the experience and actions that we need to do to address as we prepare for a potential for wave two. Nationally, that was recognised in terms of the national requirements for restarting and resetting the NHS, which again we've outlined in the presentation, and there were 8 urgent national actions that were identified to address and start to tackle health inequalities in a more targeted way around protecting the most vulnerable, restoring those NHS services inclusively, digitally enabled pathways that are inclusive where that is appropriate, but that doesn't mean that digital suits everybody. Really accelerating those preventative programs that we have been in our commissioning intentions for a significant period of time. But how do we do them? We've already focused in the presentation as well about supporting people with mental health problems, because we do know what is happening and what is coming in terms of the effect on people's emotional and mental well-being. Data, a real sort of focus on getting our data right and having complete data sets which looks and identifies where the need is, and collaborate on planning and engaging with those communities, and picking up what I've said a couple of minutes ago about engaging with those 30 community groups within our communities and within our city. Interestingly as well, this afternoon when we finish our annual public meeting, we're going into a development session with our CCG colleagues with a specific focus on health inequalities. So looking at what we've done and looking at where we are going next, particularly with our commissioning intentions, and where do we, as Jackie's just about to outline our financial position, how do we, with the money that we are responsible for, have a positive impact on health inequalities, and really drill down on the actions and the effect that we can have, which we started when that became a legal duty in 2012, and COVID has shone a very different light and a more stark light on the need to address inequalities. And that's where my colleagues will be spending the afternoon trying to focus more intently on what we do around that. Terry, I'll pause at that point.
Thank you very much, Brian, for providing us with that overview. As Brian has just mentioned, obviously one of the key things and key responsibilities we have as a CCG is as a custodian of the Sheffield Health Pound. And as you saw in the video, we have spent that money in a variety of different ways to ensure that there are high quality health services for people in Sheffield, but also in helping to tackle health inequality. So I'm going to hand over to Jackie Mills, our Director of Finance, to give us an overview on how we spent our money last year.
Thank you, Terry. So as you've just mentioned, the video outlined key areas of where the money went in 2019-20. I'm pleased to report that we met all our statutory financial duties, as well as delivering the financial plan that we had agreed with NHS England. I'm also pleased to confirm that we submitted our draft accounts in line with normal timescales, despite the challenges of the COVID pandemic, and that those accounts were audited again to the national timescales required. The auditors issued an unqualified opinion on our accounts and confirmed that we had adequate arrangements in place to deliver value for money. Those accounts are included in our annual report that is available on the website, so for any members of the public that want to look at those in any further detail, they're available. So I think because we've already outlined in the video where the spending was, I'm just happy to recommend the adoption of those accounts formally in this meeting.
Thank you very much, Jackie. As Jackie has mentioned, those accounts and the details of those accounts are available as part of our annual report and are available on our website. And at the end of this video, there will be a detailed link about how you can access that information. So I'd like to move us on now to a question and answer session. And unfortunately, we didn't receive any written questions from members of the public this year. And as Leslie pointed out, this is usually the opportunity where we interact with members of the public from Sheffield to give them the opportunity to ask the CCG questions about our plans and the way in which we go about commissioning health services. So what we have done is we have compiled a list of questions that we feel would be useful for members of the public. However, if you are watching this video and there's something that you think we've missed, or there's a question you would like to ask, please make contact with the CCG either through our website or in writing and ask the question of our governing body. So our governing body meets in public every 1 to 2 months and takes questions from members of the public about important issues that affect them. So if there is anything in the questions that are coming up that you would like more detail on, or there are questions that you feel that we have missed and you would like to understand, please do make contact with us through those routes. So I'm going to move us on to the first question, the first topic area, and that is, how is the CCG supporting primary care during the pandemic? Are GP surgeries open, and how can patients access them? So I'm going to ask Sandy Buchan, our Director of Commissioning Development, to wade in and answer that question for us.
Thank you, Terry. So the CCG's top priority during the pandemic has very much been to protect the people of Sheffield and make sure services are safe. Our role, therefore, has been to ensure the continuity of primary care in Sheffield and also to support the wider system in responding to the pandemic. Our GPs and practice staff are at the front line of the NHS and have been working in ways that have never been seen before to ensure services do remain open for our patients. If patients do need medical help, then your GP is open and will still be running many of their routine clinics. So to access services, please do call your GP as usual. If they are closed, then you should follow the instructions on the recorded message to access the right services for you. You will be triaged over the phone and then either have a phone consultation or a face-to-face appointment depending on your need. But please be assured that your GP is open. Thank you.
Thank you, Sandy. So continuing on the theme of coronavirus, yesterday I spoke with one of our GPs, Dr. Marion Sloan, and asked her the question about what members of the public could do to protect themselves and other people from COVID, and how you could go about getting a test. So I'm just going to bring up a short video of the answer that Marion gave us yesterday.
Terry, thank you for asking me those questions. These are vital questions, aren't they, at the moment? Greg Fell was on YouTube yesterday saying that the situation in Sheffield is hotting up, so all primary care needs to lift their game. We're looking at 70 per 100,000 of positives in the population, and all the tests that are going in, between 4 and 5% of them are positive. So lots of tests are being done in primary care, and 4 to 5% of those are positive. So the message is, get a test. You can go online, nhs.uk, you can ring 119, book in for a test. Test stations are all over. We're doing testing at our surgery. The girls come and they set up a testing session. There's testing sessions all over the city in different places, and they are available. And having had a test, then you have to self-isolate until you know the results. If you've got those symptoms of continuous new cough, temperature loss or change of smell or taste, you have to take that seriously. Everybody, all of us, we need to wash our hands. Very, very simple, but very, very effective. We need to cover our face, and we need to give space. So we're looking at 2 meters or 1 meter if we can't manage 2. The virus is more prevalent now. The winter weather's coming. Greg was very clear in his message to us all yesterday that we need to be very, very careful. Primary care is ready. Primary care is open for business. And I think the other message is Sheffield's open for business. We want Sheffield to stay open. The cases are rising, we know that, but it hasn't yet reached a second peak. So we have a window of opportunity. And if we get tested, as soon as symptoms start to creep in, then we can protect ourselves, we can protect our family, we can protect our bubble, and we can keep Sheffield open for business. So the message is very, very clear. Symptoms, get a test, protect yourself, protect us all.
So thank you to Marion for answering that question. As Marion mentioned, Sheffield's Director of Public Health has produced a YouTube video for members of the public, keeping us up to date on the situation in Sheffield, and also underlying some of the actions that our partners at Sheffield City Council are undertaking. And that brings us on nicely to the next question, which is how are we working with the local authority in outbreak planning? So I'm going to hand over to Dr. Zach McMurray, our CCG Medical Director.
Thanks, Terry. Yeah, we're working very closely with the council, and we've got a very detailed plan in how we can handle any outbreaks that we're getting within the city. We've got an outbreak control board, which is chaired by Julie Dorr, who's the leader of the council. And we've got really wide representation on that board. So we've got representatives from schools, from universities, from the business sector. So we've got the Chamber of Commerce, and from some of the sort of faith and voluntary sectors. So what we're trying to get is a very sort of wide view of what the issues are across the city, and then trying to work together within the government guidance, because we do have to follow government guidance, but using as much flexibility as we can locally so that we can get the message across the population and try and keep the city open, which is the main thing we're trying to do, but at the same time reduce the risk from COVID, because Marian's absolutely right, the prevalence is increasing. So we're now up around 80 to 90 per 100,000 population per week of positive tests. So prevalence is probably a little bit higher than that. So at any one time, there are probably a significant number of people within the community who are now infected. So we do all have to be careful, and it's to stress Marian's message again about 2 meters distance, wear a face covering, get tested if you do have any symptoms. And probably the most important thing is actually just wash your hands. You know, Greg is fairly clear that that's the thing that really makes a difference, is to actually keep a clean environment and stop the virus spreading that way. So we're working very closely with the council. We're trying to respond to any local outbreaks that we get, but trying to respond in a way that actually gives people as much freedom to get about their daily business. We're also working closely with practices, because clearly we've got to maintain a safe environment for patients and practice staff. And that's why we're really encouraging patients to wear a face covering whenever they go to the practice, but also be considerate, because your practices are under considerable strain. And we just ask you to be patient and you know, contact your practice as before, but be aware that they have to work in a very different environment. So you may not get the face-to-face contact that you had before, because that's not necessary. And obviously that is a risk in spreading the virus. So working across the sectors, it does feel as if it's quite tight in Sheffield, and that we're responding quite quickly. Because we've got quite an inclusive group, we get a very rapid feel for whether there are any issues across the city. And we're just hoping that the current upturn that we're getting will actually start to dip down again, because of some of the tighter measures that have been brought in nationally. But we will do anything we need to do locally to tighten the situation if we have to. Thanks, Terry.
Thank you very much, Zach. So one of the other important sectors, one of the other important support services that the CCG works with is nursing homes. And during the first wave of the pandemic, nursing homes were particularly vulnerable. So I'd like to ask our Chief Nurse, Alan Windle, what support is the CCG offering to nursing homes?
Yes, thank you, Chair, and an equally important question. I think myself and the wider CCG and partners across the city are aware of the significant impact that the COVID crisis has brought, and the significant pressure to this sector that's happened. As a system, we've worked with our partners as part of the Sheffield Accountable Care Partnership to provide a truly coordinated system response to care homes, and to offer residents, family and staff, importantly, the support that they require. This has included, but really not limited to, for example, support with guidance and training around infection control and personal protective equipment, which was really important to suppress any transmission of the virus. We've supported, along with St Luke's, end-of-life care to provide additional care for support residents and families, again across the care home sector, which has been really important. We've also had additional capacity in transport to safely transfer individuals home in the city, but also be able to provide increased urgent care to support individuals who require support, again across the city. It's a short notice until packages of support and care can be put in place. There's been additional workforce support within relation to the care home sector and nursing home sector from Sheffield City Council and Sheffield Teaching Hospitals, including CCG staff who have also supported this sector extensively with different measures other than what I've currently outlined. We've also successfully implemented a local response to swabbing to complement the national swabbing service, which has been extremely effective. And to end, I think these few key points, we've had a really effective cross-partner coordinated mutual aid offer that ensured the availability of the protective equipment across the city, and the continued clinical support that primary care have provided to the sector have also been really invaluable. As I stated, I don't think this is an exhaustive list of collaboration support to care home, as there are multiple examples of excellent working to support the sector in Sheffield. I'm really quite proud of that.
Thank you, Alan. So I'm going to move us on to a different topic now. So whilst we've heard lots about the way in which coronavirus has affected people physically, Brian mentioned and brought up the fact that coronavirus has affected lots of people in other ways, and in particular has had an impact on people's mental health. So I'd just like to ask Sandy again, what are the CCG doing about mental health in light of COVID?
Thank you. I think it's what we've heard already is coronavirus has impacted us on us all, and it's now more important than ever to look after our mental well-being. So in regards to that impact, some people may be causing some people to be anxious, stressed, worried, lonely or frustrated, a number of different emotions, but it may be causing a big impact on some people's mental health. And therefore, as a CCG, we've been working with our partners and public health to identify what impact COVID-19 has had on people's mental health. We've been listening to people to look at what services will help during this time, and we've been doing a number of pieces of work in order to provide this service. Some which includes working with partners to produce accessible materials aimed at offering psychological support and advice during the pandemic, such as targeted materials for people from BAME backgrounds, learning disabled people, children and young people, people with dementia and their carers, people with autism, frontline key worker staff in care homes, hospitals, supermarkets, and we have delivered training in psychological first aid, which the materials are on our local mental health charity, Sheffield Flourishes website, which was accessed quite a lot during the lockdown period. We've worked with our partners across the region to deliver a bereavement helpline for those impacted by COVID, and Sheffield Health and Social Care NHS Trust have developed a COVID-19 helpline for the public and for staff, which have obviously been working hard during these challenging times. Sheffield IAPT has been delivering online coping with COVID courses and has also been continuing to deliver therapy through online and telephone support. We've initiated COVID-19 helpline for children and young people through a partnership between Door 43 and Sheffield Children's Hospital CAMS services. We've also contributed to a citywide coordination of a wide range of practical resources for supporting mental health and emotional wellbeing for pupils, teachers and parents and carers. So it's safe to say your mental health is absolutely important, and we are continuing to provide these services along with others to help you through these challenging times. So please access them and use them for looking after yourself and your mental well-being. Thank you.
Thank you, Sandy. So just going to now bring us on to the next topic question. So over the last couple of months, we have heard that this year we will be delivering the biggest ever flu vaccination campaign. And I'd like to ask Dr. Lee Sorsby, a GP in our city and governing body member, can I and should I get my flu jab this year?
Thanks, Terry, and apologies that there's no camera. It may all be a blessing for you that you can't see me, but I have a slightly unreliable internet connection, so you'll have to make do with just my voice. And the answer is, can you get your flu jab and should you? Yes, if you're eligible, absolutely. Flu is an absolutely horrible illness. I've had it myself. I never want to have it again. It isn't just a bad cold. It's a horrible disease which affects your whole system, knocks you out of action for at least a couple of weeks, and can have serious complications. And sadly, it can also be fatal. So every year in the NHS, we see thousands of deaths due to flu, which are all potentially preventable. The good news is there is a vaccine which is both safe and effective, so therefore it absolutely makes sense to be vaccinated and therefore protected against flu. It's particularly important if you're in one of the high-risk groups who are eligible for a free NHS vaccine. So these are any adult age 65 and over, anyone with a learning disability, pregnant women, and anyone aged 6 months and older who has an underlying health condition such as asthma or diabetes, heart disease, and other long-term conditions. The other large group where immunisation is important is in children. Flu can be a very severe illness in children, and again, sadly, it can be fatal, and we do see a number of flu-related deaths in children each year in the NHS. The other important factor is we also know that children are a significant source of spread of the infection in communities, so therefore it's doubly important that they are immunised. And the age groups that we recommend should be immunised are any child who's aged 2 or 3 on the 31st of August 2020, all primary school children, and all children in Y7 in secondary schools. And just a little added bonus, for children they don't have to have an injection. The vaccine is given via a nasal spray, so it's a little bit more acceptable for them. So those are the main groups who are at risk due to their own health, but there are 2 more groups which are also at risk due to spread and exposure. And these are frontline health and social care workers, and also someone who is living with someone who's shielding. So if you fall into any of these categories, your GP will have ordered a vaccine for you, and it's important that you avail yourself of it and are therefore protected. I know that talking to my friends and colleagues and also patients, some people are a bit worried about going into their GP practices at the moment. I think they have memories of the flu clinics in the past, which have just been a turn up and be vaccinated and obviously quite crowded. Well, just to reassure people that this year that won't be happening in GP practices, and systems will have been put in place to ensure that everybody is safe, that social distancing will happening. And you may have noticed that if some people have already received invites from their GP practices, sometimes it's done via appointment or certainly in much smaller groups, so that people absolutely will be safe to attend and get their vaccine. Just to also add, this year, because of the concerns around the challenge that we know exists about COVID and its likely impact on the NHS this winter, the government has also recommended that there's an additional cohort of people who are aged 50 to 64 who will also be eligible for a vaccine once the initial high-risk groups have been immunised. So we haven't as yet had all the details about how this will be administered, but we are expecting guidance from the NHS England later this month or early November about that 50 to 64-year-old age group. So in summary, flu is a horrible illness. It does cause thousands of deaths every year, but there is a safe and effective vaccine, so it absolutely is important that you are protected, particularly in the midst of a current worldwide pandemic. Getting ourselves protected obviously protects our family, protects our friends, it protects the wider community, and ultimately will protect the capacity within the NHS through what is likely to be a very challenging winter. So the answer, Terry, is yes,
Thank you, Lee. And I'm looking here to my CCG colleagues on this one, that we will be vaccinating our own frontline staff against flu. And I would really encourage every single member of CCG staff to take that vaccine offer up. So as we heard in the video, NHS England have recommended that CCGs through phase 3 of COVID planning now work with system partners on areas like outpatient appointments and cancer services. So I'm going to hand over to our Deputy Accountable Officer, Brian Hughes, to give us an update on what we're doing in Sheffield.
Thanks, Terry. And I'll pick up cancer first if I can, because again, it's been reported in the media, particularly in the early stages of the pandemic, around the delays and the non-presenting patients who may be suspected cancer, and the catch-up that we're having to do in terms of getting those numbers through the system in a COVID-secure environment. But again, Sheffield, South Yorkshire and Bassetlaw has a long record of working with our system partners, both locally in Sheffield and with the Cancer Alliance across South Yorkshire and Bassetlaw, in terms of looking at our capacity, the specialism that we've got, the value that we've got in Sheffield of having a specialist tertiary centre, in terms of how we use that. And the partnership, the Cancer Alliance partnership, allows us to discuss and problem solve on a much wider platform, looking at the available capacity, both NHS and more recently, particularly in the environment that we're living in, the capacity that exists within the independent sector, of maximising that capacity and being able to treat as many patients as we can. So it looks at both waiting lists and performance, and it enables us to ensure that we can have a system-wide response to recovery, because we know we are in recovery mode. But that is responsive both to us as Sheffield and Sheffield residents, and also our contribution across the South Yorkshire and Bassetlaw system as well. So that's an initial focus on cancer. On outpatients, so over the last number of years, we've taken an approach to planned care that centres on a whole journey pathway that sees primary care GPs and hospital consultants working together to provide a joined up care for patients and involving them in that journey and in each step of their treatment. In addition, wherever possible, we've sought to develop pathways and care services outside of hospital, closer to patients' homes, in a way that's right for the local community. And a couple of examples that I'll sort of pick up around that in working in that collaborative way is working directly with consultants, nurses and managers in individual specialties within hospitals, and working along GPs and other clinicians to agree how best care can be provided across that primary and secondary care interface, and allowing those changes to happen in those services. Very strong and clear message around participating in the development of patient-initiated follow-ups, which means patients can decide for themselves if they need to return to hospital, or if perhaps a phone call, or leaving it a little bit longer for treatment or for sort of checkups could be best for them. And again, very real examples recently around enabling more appointments to happen over the telephone or via the internet, if that's appropriate for the patients, and it would make things easier for the patients. So it refers to what I've said earlier on digitally enabled pathways, but a recognition in all of that that does not suit everybody. So we have to find the balance and the blend between those. We work collaboratively with local partners such as our hospitals, Primary Care Sheffield, which is our primary care provider at scale, and our local authority and the council to develop and deliver changes to across Sheffield, so that our changes are right for local patients. An example of that is this year we went live with a joint community gynecology and sexual health service specification and procurement with Sheffield City Council, meaning that these services are now consistently available in the community nearer to patients that needs them. It always hasn't been easy in terms of changing and challenging the traditional ways of working. But again, the experience of COVID and that needs must mentality has accelerated probably than any of us would have predicted or planned for, that ability to work differently and effectively. That brings us much closer to our aims of bringing care closer to home. Again, another example of that is in this month, last month, we're now in October, 1st of October. In September, we agreed and enabled GPs to be able to send photograph and pictures with their referrals for skin conditions, which means in a lot of cases that patients can now receive a consultant opinion without having to travel to hospital to decide that seeing them might not actually be necessary based on an image that's able to be sent through. And consultants and their colleagues at the hospital have been able to telephone patients, or in some cases use video calling, to hold their consultations and their general follow-up conversations with patients, rather than take them into a hospital environment, particularly in the environment that we're working in the necessary needs around COVID secure environments as well. That's a couple of examples, both in cancer and in outpatient treatments. Thank you, Terry.
Thank you, Brian. That's all for the questions and answers. As I previously mentioned, if you're watching this video and you feel that there's more you'd like to know about what the CCG does, or you feel that there's some further questions you would like to ask, we always welcome questions and challenges from the members of the public, and you can ask those questions of our governing body through its public meetings, which are also held online. There'll be some details coming up at the end of this video about how you can make contact with the CCG. So I'm now going to hand back over to Leslie Smith and Brian Hughes for their closing thoughts and comments for this year's annual meeting.
Thank you, Terry. I think that probably brings us to the end of what's been a very unusual format for our annual public meeting. I do hope that everyone who takes the opportunity to listen or to view our annual public meeting virtually finds it both interesting and informative. I think it's important just to reiterate our thanks to everyone who's been involved and worked so hard to make this morning possible. And even more than that, I think to pay our thanks to all of the health and care workers across Sheffield who are doing so much to keep, as Marion described, Sheffield open and health and care in Sheffield on the road. So thank you very much to everyone for all that they're doing. I never thought I'd see the day when I ended an annual public meeting with the messages of hands, face, space, and if you're eligible, get your flu jab. But I think those are really important messages for us all to heed. And by doing that, really hope that we'll be able to meet you all again in person next year. Thank you. And I don't know whether, Brian, I've missed anything that you would like to add in conclusion.
I think I'd just like to sort of echo an optimistic point that hopefully we will be able to be back to be normal next year and see people in a physical environment. So that would be my optimistic note that I'd like to hope we finish on. Thank you, Terry.
So thank you, Leslie and Brian. That closes this year's annual public meeting. We look forward to seeing you next year, be that virtually or, as Brian has said, optimistically in person. Thank you.